We want to talk a lot more about all these fast-breaking developments. Let me bring in disease ecologist and president of EcoHealth Alliance, Peter Daszak, and the Emergency Department Medical Director at U.S. Acute Care Solutions, Dr. Nicholas Steinour, joins me here now in Austin. Peter, let me start with you. And when you hear that someone as respected as Dr. Fauci says that the disease has now reached outbreak proportions and likely pandemic proportions, what's the first thing that comes to mind for you?
Well, now is the time to get prepared. We can do a lot to prepare our homes, prepare our workplaces, and get emotionally ready to deal with this outbreak. I agree with what Dr. Fauci is saying. He really knows what he's talking about, and now's the time to listen to that advice, read up about this virus, and not to panic, but to confidently and quietly get ready in case you end up in quarantine or a loved one gets sick.
So, Doctor, there are, as we know, confirmed cases in many parts of the country now, California, Oregon, Illinois, Rhode Island, here now in Texas, the concerns raised about the CDC. The question is, how difficult is it going to be to trace? Because don't you have to trace to contain? And I'm just going to show folks some kind of astonishing statistics. New York City, for example, again, only one case, but they acknowledge it will probably grow. It has a higher population than 40 out of 50 states. 1 out of every 38 people living in the United States lives in New York City. There are 27,000 people per square mile. How big is the challenge here for containment?
Yeah, it's a great question. The challenge is big. I think that's why it's getting as much press and attention, because it deserves it. The good news is we prepare for this all the time. There are drills ongoing in local communities at the state level as well as the national level to organize around events just like this so that we can contain as best we can, take care of the patients that we can take care of, and those that are sick and need hospitalization, we have the resources available to care for them.
So give me some specifics, because I think one of the things that people hear a lot is we're ready, we're prepared, but they don't get the details. What does that mean? So what are you folks doing, for example, that I'm sure is being replicated in many places around the country?
Great question. So I work with the group U.S. Acute Care Solutions. We staff over 200 hospitals across 22 states in the country. Just this weekend, we had a call to assess preparedness levels and to give guidance so that each place has a protocol, has resources, and each of the staff, and that's techs, that's the people who clean the rooms.
Are you confident of the resources that they have? We've been hearing about the shortage of test kits, for example.
Sure. So that's a CDC issue as far as the testing goes. As far as the support that we have, I can tell you our hospitals do have the ability to get samples. We're doing that actively now, and that gets sent off to the CDC for confirmation. The good news is 80% of these folks do not need any hospitalization. They can go home after the test is obtained and wait for those results with some self-quarantining principles in place.
Yeah, but if you have no rapid diagnostic test available, if you have to send it to the CDC by the very nature of that delay, aren't you increasing the problem?
I don't think we're increasing the problem because we're giving strict precautions. So if you come in to my hospital and you say I have reason to believe I'm a person under investigation, the health department does a very good job taking that care. When you go home, there's no reason for you to stay in the hospital if you're well. You go home, there's precautions on where you should be. If you've got a bedroom that you can keep yourself in, that's where we'd like you to stay. If you've got family or regional support from friends or the community can give you resources so that you're not infecting others in the community, so that we can really try collectively to prevent this from spreading.
Exactly what the New York patient is doing. Peter, yes. Today, Google Trends shows, and I think this won't surprise anybody, that the search for Lysol and face masks have surpassed searches for the Kardashians. That doesn't happen very often. The rush for masks is so great that the Office of the Surgeon General felt it had to put out a tweet over the weekend saying, and I'm quoting here, "Seriously, people, stop buying masks." How big is the non-medical challenge, which by that I mean getting out clear information that people will heed?
Communication is everything right now, and it's incumbent on anybody who manages staff, anybody who runs an organization, to get ready for a pandemic. Talk to your staff, get ready for people to be off work working from home. And for those of us who are concerned, read up about what it's like to be in your house for 14 days. It's not so disastrous, but it's good to be emotionally prepared for that. And yes, it's good to have wipes, disinfectant wipes, etc., but face masks right now are not necessary for people who aren't sick. They're for people who are looking after people who are sick and for those who are sick. And if we start panic buying, then the medical professionals run out of masks, and that's a real problem.
Well, the other issue, Doctor, is, and the point that the Office of the Surgeon General wanted to make is most people shouldn't be wearing masks anyway. That's not the issue right now. Since you had that call and you talked to so many hospitals around the country, is there one or two things that you are hearing over and over again that you'd like to get out the answers to right now so that people can know that their questions are being answered by a professional?
Sure. So, so one of the questions is, how do we make sure that we as healthcare providers stay safe? And there's protocols for protective equipment at the bedside when you're encountering and taking care of patients who potentially have the disease. But that's one thing that we've gone through, and making sure that we have those resources, which is why Dr. Adams, the Surgeon General, has said, please don't consume these resources that are needed for the people where it actually has benefit. I'm not wearing a mask now because there's not a risk here. The risk is when you have areas where we know there's exposure, so that those individuals who are caring for them, as well as the patients, can protect themselves and others around them.
Well, I want to thank both of you, Dr. Nicholas Steinour, and Peter Danshuk. Thank you both.